Assalamu alaikum. The long clinical consultation day start with Mrs. Sophia, 30 years old, referred with complaint of diarrhea. Okay, ready?
Okay.
Yes. Here you go.
Okay. Hello, Mrs. Sophia. My name is Dr. Abdullah. I'm one of the doctors at the clinic today. Can I confirm your age, please?
Yes, I am 30 years.
Okay. Just I will take some notes your answers to my question today, so that I can help you with your symptoms. Be sure that all of them will be confidential. Is that okay with you, Ms. Sophia?
Sure, doctor.
Can you tell me what brought you to our clinic today?
Yeah, doctor. I have been suffered from loose motion for a long time now, doctor.
Can you tell me when this one started?
Yeah, almost 6 months now.
And this is the first time it happens?
Yes, since 6 months.
Okay. I mean, this is the first time it happened. Never
Yes.
happened before.
Yeah.
Okay. Is it worsening or is this getting better?
It's on and off, doctor.
Okay. Can I ask you what seems to increase this this diarrhea or this loss of water?
I noticed the stress, doctor, might worsen it.
Okay, I'm sorry to hear that. Does it come in a specific time of the day?
No, doctor, but always whenever I am awake.
Okay. So when you are not stressed or asleep, this will not happen. Okay. Can I ask if sometimes you have constipation with this diarrhea?
No. It's only loose motion.
Okay. Can you tell me how much is the amount of this diarrhea?
It's large amount and water-like, doctor.
Okay. Is it difficult to flush?
No. It's water.
All right. Sorry to ask, if there is blood or slime with it?
No.
Okay. Can I ask you, is it related to a specific type of food, like pasta or milk?
No.
Does it improve by fasting?
No, not related.
And it does not awake you from sleep, right? You told me. So
No.
And is it changing like black in color or no?
No.
Okay.
Only water.
Okay. Can I ask you if you have any acid brush in your mouth?
No.
Any difficult swallowing?
No.
Any tummy pain?
Yeah, I have some cramps whenever I have this diarrhea.
Okay. Can you tell me how much? Sorry to ask you how much is the severity of this pain on a scale of 1 to 10?
Like 5 to 6.
This is like cramps, you told me, right?
Yeah.
Does it go anywhere, this pain?
No.
Only in your tummy?
Yeah.
Okay. Can you tell me if you have any like vomiting or feeling of like vomiting?
Feeling sick? No, doctor, I'm not feeling sick.
Any also vomiting of blood you have?
No throwing up.
No throwing up. Okay. Any change in the color of your eyes?
No.
Any shakiness of your hand?
No.
Any difference in your like concentration or your consciousness?
No.
Okay. Can I ask if you have
Yes.
had fever during this month?
No.
All right. Did you travel during this last 6 months or before the 6 months?
Actually, doctor, I traveled recently to Thailand, but I think it was before that.
Okay. So you did not travel before these 6 months in the period
No.
of the last year. All right. So to ask you some private questions, is that okay?
Mm-hmm.
Can I ask if you're married?
Yeah, I have partner.
Okay. So to ask you, did you have any casual relationships?
No.
Any sharing of needles?
No.
Any tattooing?
No.
Any previous blood transfusion? Recurrent blood
Mm,
transfusion? Okay. Okay. Any weight loss?
no.
Any weather preferences?
No.
Any lumps or bumps on your body?
No.
Any back pain?
No.
Any joint pain?
No, doctor.
Any skin changes or
Uh,
muscle?
not not so, doctor. I'm not sure about it.
The skin changes?
Yeah, what do you mean by skin changes?
Did you have any like rash?
No, it wasn't rash, doctor.
Um, can you show me if there is like less pigmentation of your skin? The pigmentation is affected?
No, it wasn't like that, doctor. I noticed some redness in my face sometimes.
Okay. Does it come and go? This
Yeah,
redness?
on and off. I noticed also on and off.
Okay. Sorry to hear that. And this has also for 6 months, this one.
Mm-hmm. Yeah,
Does
the
it appear
same.
also on your chest?
And no, mostly in the face.
Okay. Can I ask if you had any attacks like of noisy chest or shortness of breath?
Yeah, doctor, you're right. At the same time, I feel also, and I hear some noisy breathing
It has been going also for the past 6 months.
on and off. Yes.
Okay, and you have no weight loss, right?
No.
Um, did you have any eye changes?
No, doctor.
Any urine changes?
No.
Okay, can I ask if you have any past history, past problems in your health?
No, doctor.
Any past problem, any past like surgeries you had?
No.
Any family history? How is the health of your family?
Yeah, my father was having cancer colon.
Okay. I'm sorry to hear that. How about any medications that you are receiving?
No.
Did you receive, sorry to ask you this, the laxative that will cause this, can lead you to have this diarrhea?
You mean herbal? No.
Okay. Did you receive any antibiotics for the previous 6 months or 9 months?
No.
What's your job, Mrs. Sophia?
I'm cashier.
Okay, how much is this affecting your job?
It's not that much. Whenever I have the attacks, only, doctor, I feel worried because I'm going frequently to the washroom, feeling flushed in my face.
Okay, I'm really sorry for that. I will help you and I refer you to the occupational health physician. Are you smoking, Mrs. Sophia?
Yeah, doctor.
I would advise you to stop smoking, and it can really be bad for your health.
Okay.
Are you drinking alcohol?
Yes, doctor, socially.
Okay. So how about sorry to ask you some other private questions. How is your periods?
No, regular, doctor. Nothing changed.
All right. Have you ever got pregnancy?
No, doctor.
All right. And have you ever been sorry to ask you, abortions?
Miscarriage? No.
Miscarriage? Okay. All right. So can I examine you, Ms. Sophia?
Yeah, sure, doctor.
All right.
What do you want to examine?
First of all, I want to examine the abdomen. I want to palpate the right iliac fossa first. Sorry, if there is any mass, or and I will do superficial palpation if there is any mass in the right iliac fossa.
Okay, so you'll start by inspection, you mean? Okay, you'll start inspection, no scar.
Okay.
Yeah, no previous surgery, or yeah, no scars, no hernias.
All right. Any can I palpate the liver? Any
No hepato or splenomegaly.
All right. Any mass in the right iliac fossa?
No masses.
Any ballotment change in the ballotment of the kidney?
No.
Okay. Can I check her hands? Any hand changes?
No, nothing. No clubbing, no tremors.
Okay. Any change in the sorry, can I check the pulse?
Pulse is regular.
Okay. Blood pressure sitting and standing?
Normal, no change. No posture hypertension.
Can I check the eyes if there is any pallor or any anemia?
No pallor, no jaundice.
Can I check the mouth if there is any glossitis or any like ulcers?
No sores.
Can I examine the chest? Auscultate the chest. Any noisy chest? Sorry, any wheezes?
No wheezes currently.
All right. Can I examine also the skin of the face and skin of the chest? If there is any redness?
No redness right now.
All right. Can I check also the other parts of the body if there is any rash or any skin changes?
No skin changes.
Can I check the lower limbs if any edema or any rash also?
No edema, no rash.
Okay.
What else do you want to examine?
I think that's it. I think I will go to the concern now.
Okay. You don't want to examine the heart?
Yes. Yeah. Can I auscultate the heart?
Okay. What exactly and what area you want to hear?
I think the tricuspid area and the pulmonary area.
Excellent. Okay. So what you can hear over both?
I think tricuspid regurg and pulmonary stenosis.
Excellent. Okay.
Did you have any chest pain, Mrs. Sophia, or
No.
any racing heart?
No.
Okay. What's your concern, Mrs. Sophia?
Doctor, what I have, is it cancer?
So, after examining you and taking full history, I think I'm sorry to tell you that what you have is can indicate that you have something called carcinoid syndrome. Unfortunately, this carcinoid can be secondary to some like nasty growth in your bowel. I'm really sorry, Mrs. Sophia. Any other concerns, Mrs. Sophia?
So is it cancer, doctor?
Yes, I'm sorry to tell you that, Mrs. Sophia, that it can be cancer. It can be a nasty growth in your bowel. So we need to really run some camera tests for you.
1 minute.
We need to run camera tests for you to have a proper visualization of your bowel and check any nasty growth. We can take a sleep for it to run some more tests, and also we will need to run some lab tests and some like imaging for you to confirm this diagnosis. Any other concern, Ms. Sophia?
So, doctor, again, it's a cancer.
Yes.
There is possibility to be a cancer, right?
Yes, it is. Yeah, there is a possibility it can be cancer. I'm sorry to tell you that.
Yes. Okay. What you will do with me, doctor? Will you admit me?
So first of all, we will admit you and run camera tests for your bowel to check your bowel and to take a snip if needed, and also we will do some urine tests, and also we will do other
Okay,
like
time up. We'll go to the examiner questions. Present your case.
so on examining this. So in taking history and examining Mrs. Sophia, because she has like attacks of diarrhea and attacks of redness of the skin, also with attacks of noisy chest or wheezes. This can indicate that most probably she has carcinoid syndrome. This carcinoid syndrome with the past medical history, the past family history of cancer colon could be secondary to presence of cancer colon also with Mrs. Sophia.
Okay, so yeah, give me 3 differential. Yeah, take a breath. Then give me 3 differential. You have patient complaint of diarrhea. Young female.
And it could be autoimmune diseases like like celiac or celiac disease or
Yes,
IBD.
why not? Yes, you can put it, yes.
Yes, but against it the attacks and does not it and it
Not
is
related to the food, yes.
yes, and
But you
also
can still put it, yes. What else? Very important what?
very important, yeah, can be IBS, but it is
Yes, exactly.
the lowest in the list.
But still, it's related to stress.
Yes, it's related to stress.
Okay.
It can be IBS.
Okay. Then how you investigate this patient?
So, first of all, I will do colonoscopy for this patient.
First of all, colonoscopy before any blood or urine tests? Yes.
Yes, sorry. I'm sorry. So first of all, we will do basic investigation, CBC, kidney function test, and the liver function test, electrolytes, and also we will do the urine test for HIAA, hydroxyindole, and I think the name hydroxyindole acetic acid.
Yeah, excellent.
Yeah, and then because of family history of colon cancer, we have to do like CT imaging of CT abdomen with contrast over the body and over the abdomen, and also we need to do colonoscopy for her.
Okay, before going to invasive procedure, what other investigation you will do? Always be start like gradually.
Okay.
Non-invasive, semi-invasive, then invasive. Okay, you write in the finding some complication in the heart. What you could do for?
Yes, that's right. So we can do echocardiogram to diagnose if there is any valve like valve affection secondary to the carcinoid, like tricuspid regurg or pulmonary stenosis. And also
the ECG, right? Okay.
Yes, also.
Okay.
And then
what the tumor marker for a carcinoid? What's called?
I'm not sure. I think I know the bus by
chromogranin A. Chromogranin A.
chromogranin A. Okay.
Yes. Okay. Finish the investigation. Yes. Now the role for colonoscopy. That just colonoscopy or what else? And before the colonoscopy as invasive, what image you will choose to do?
There is a specific type of CT abdomen that they are doing. I think
Which?
octreotide.
Excellent. Yes.
CT abdomen, yes.
Yeah,
They are
octreotide. Okay. What other can do? Other tests? PET scan? Yes.
yeah,
So
can
PET
be.
scan, CT,
Yes. So
and yeah, the last octreotide based. Okay. What endoscopy or invasive procedure we will do? And what's the areas suspected to be located?
um
I mean the cancer or the mass or the carcinoid. Okay.
yes. Yeah, the most common site is cecal area.
Small bowel.
The small bowel? Okay, sorry.
Then
all right.
yeah,
Then
the large bowel. Then what else? This is in the GI.
it can be in the lungs also.
Excellent. Bronchus, lungs.
It can be in the lungs.
Yes.
Mhm.
Okay. There is role of third multiple lesions, and third in the small bowel, and third are cancerous. Role of third. Okay. How to manage this patient?
So first of all, non-pharmacological, like
Excellent.
patient education, patient counseling, and referral to multidisciplinary team,
Excellent.
like the oncology doctor and the GIT doctor and the chest doctor. Sorry, the pulmonology doctor, and then pharmacological.
In the form of?
I cannot remember the name now.
You mentioned it in the CT guided or CT.
Octreotide, yes.
Yeah. Octreotide, somatostatin analog.
Yes. And then to refer her to the GIT surgeon to if the sources.
Yes.
Yeah.
Exactly. If single lesion or no metastasis can be amenable for surgical removal.
Yes, that's right.
Yeah, if multiple or metastasized or spread, we can think about chemotherapy.
Yes, that's right.
Yes. Okay, this is the case. Thank you, Dr. Sarah. You did it well. If I didn't mention the skin lesion, you will be more stressed, but
yes.
Yes. But don't be panic. You will find a clue. Nothing will be only diarrhea for no reason. You screen it well, the HIV, the analysis, the GI itself, relevant system analysis. So it might be like this scenario, only carcinoid syndrome. It will come with the triad of flushing, wheezes, and diarrhea. The diarrhea, as you get from the case, watery like, and only with the stress coming in attacks, and the attacks will be the form of 3 or the triad mentioned earlier. It doesn't awake from sleep, and it's not related to the food. You should screen for all causes of diarrhea in young female. The blood at the back passage, very important to rule out inflammatory bowel disease, relation to the food, and celiac, Addison as well, by asking the pigmentation or the skin. All these common scenarios in the exam, you have to rule it out. Starting by irritable bowel syndrome, also you have to roll it. It's a very common topic. So by asking the related to stress, alternated with constipation, relief when you pass bowel motion, doesn't awake you from sleep. All this will go with irritable bowel syndrome. Sometimes you have also, the patient might have tension headache, any other stressful disease. So this is the possible cause in young female. If you rolled all this out, you can screen for HIV, any HIV risk habit. If you roll it out, you can ask for the travel. If you roll it out, you can think about cancer colon, but it will not be in such age unless Amsterdam criteria will be met for the cancer colon. And when I told you there is family member or father had a cancer of colon, you have to screen it. How age he was, how old he was when he was having this cancer, and other family member, and so on. Okay. The herbal also very important to roll it out. However, it doesn't, or it doesn't come in the exam to be herbal only induced. Not common. The only system review you didn't ask about, but you should examine if you didn't ask, cardiovascular system for the cardiac involvement, which are TIPS, tricuspid incompetence, pulmonary stenosis. Apart from this, in the examination, you might have normal, healthy person. Nothing, because it's free in between attacks. Okay. Constitutional symptoms are very important because carcinoid itself might come as cancer. And this one was one of the concerns of the patient. Is it cancer? And you should answer clear. Don't say nest growth. I'm asking you, is it cancer? Tell me there is possibility. I'm afraid to say there is possibility to be a cancer. So, however, we will run some workup, including camera scan, and we'll update you about the result. Don't say another word, or don't try to give her another answer, because she will ask you again and it will affect your mark for the concern. Answer the concern clearly, okay?
Okay.
Apart from this, the examination was perfect. The abdomen, you can offer inguinal lymph node and hernias and digital rectal examination. Just rule out any cause of local cause or bloody diarrhea. Even you ask about the blood in back passage or black back passage, important also in this case. Yeah, I think this is the case. The triad I again mentioned, triad of flashing, wheezes, and diarrhea. It might be normal during examination. So it can be as a surrogate. Patient will come as a surrogate. Even the patient will come, he will not have or she will not have any symptoms or signs apart from cardiac if the heart involved, like tricuspid incompetence and pulmonary stenosis. Finding by examination or auscultation or whatever. The investigation, as you said, 5-hydroxy in acetic acid in the urine, chromogranin as a tumor marker, and other investigation, imaging, CT, MRI, PET scan, all to localize the area of the cancer. Is it a small bowel as the commonest one, the large bowel, the bronchus, the lungs, whatever the lesion is, you have to locate it by imaging. Then you can do invasive procedure, either endoscopy, colonoscopy, upper GI, bronchoscopy to take a sample or biopsy to confirm diagnosis. And according to the finding, you will refer the patient and they will decide either for surgical, if still early stage, if advanced can be for chemo, or sometimes they are giving somatostatin analog, octreotide, target the mass as a chemotherapy. Yeah, this is the case. If anyone want to ask any question or comment. Thank you, Dr. Sarah. Well done. But don't be panic.
What is the main complaint of these patients?
Complaint was
Came
diarrhea.
later.
It might be, by the way, it might come either flushing or wheezes or diarrhea. All of them can be as a presentation, and you can screen and analyze till you reach to the underlying cause. Okay. Right ileum is the main site of carcinoid. Still the small bowel, yes. And sometimes they are writing appendix, but still in the small bowel. In diarrhea, Dr. Qadi, on examination, we have to look for signs of dehydration, postural drop. I think that carcinoid tumor causes secretory diarrhea, which means nocturnal too, and it doesn't disappear with fasting because serotonin leads to secretions by bowel even when fasting. We should ask about the quality of life with it, as it really disturbs the patient and involve occupational health. Yes, the serotonin cause peristalsis, and the peristalsis potency of the peristalsis will not give time for water and salt absorption. That's why the patient will have watery diarrhea. This is the explanation for diarrhea in carcinoid syndrome. So I think whenever the patient having stress, he will have the symptoms. Unless the serotonin takes long to be washed out from the blood, maybe it will awake the patient, but I think it's not. Okay, manifestation of the carcinoid usually, Dr. Aisha, occur in the patient with liver metastasis due to production and release of serotonin direct in the bloodstream. Classically, the carcinoid syndrome is characterized by episodic flushing, tachycardia, diarrhea, and bronchospasm. Yes, exactly. Yeah, it might metastasize to the liver, yes. So according to the stage, we have to do CT CAP or PET scan or octreotide guided CT. Okay, my case here, I mean symptoms appear in metastasis to liver.
No flushing and palpitation, and this even without metastasis, I think. This feature of carcinoid even without metastasis.
Yeah. Not only by liver metastasis, Dr. Aisha, I didn't get you, but yes, it happened even without liver metastasis. So you mean only to be metastasized and to be symptomatic should be metastasized to the liver? So how they will operate all this? As serotonin, I think, yes. No, I don't think so. If like this, so all carcinoid will be cancer, but there is possibility to be benign. So I think theoretically cannot be. Okay, female. So Mrs. Lisa, 30 years old female patient, complain with back pain, short of breath, and palpitation. Okay, Dr. Sarah, 2 minutes.
Assalamu alaikum, Dr. Basim. Only one comment for Dr. Sarah.
Sure.
Yeah, actually, well done. And you cover everything. But only one comment for Dr. Sarah. I hear a lot of jargon. I mean, one or two.
Yes, I corrected her every time.
Yes, you tell hallucination. she told you diarrhea.
Yes.
Yes, and like constipations also, better to say it hard motion. So if one or two, no problem. But if with more jargon, it will be against hard. So just be care about jargon.
Yeah,
That's
thank you,
it.
Dr. Naida.
Thank you.
Thank you for your comment. Take care, Dr. Sarah. Yes, I didn't correct that. But yes, try to control the jargon. Whenever I'm correcting you, but if you used to do, you will do it in the exam. Okay? So try to control it from now. Thank you, Dr. Hunaida, for reminding us and reminding Dr. Sarah. Thank you.
Yeah.
So let's read the comment from Dr. Aisha. It's important also to know. Only 10% of people with carcinoid will develop carcinoid syndrome. Major symptoms: hot, red facial flushing, diarrhea, and wheezing. Carcinoid syndrome occurs when the tumor produces excessive amount of serotonin in an individual with liver metastasis. In patients who have no spread to the liver, the serotonin released by an intestinal tumor will be broken down to inactive substance. Thus, carcinoid syndrome doesn't occur. So you mean 10% only will present, and 90%, if no metastasis to the liver, they will not present.
They will present by other symptoms. And this tumor can obstruct the intestine. It can in the lung making like coughing blood, EMAS symptoms. And they really carcinoid, if in the studies they said like spread, because it is not really like
so it's malignant.
Yes, not the other malignancies, not like the other يعني ما بيتصرف زيهم، يعني هو شوية ليه وضع خاص يعني.
Okay.
هو حتى بيسموه سبريد، او يعني بيسموه يعني الميتاستاسيس بتاعه شويه كنترول يعني خصوصا ان هو نيورو اندوكراين، يعني من الحاجات اللي شويه البروجنوسيس بتاعها كويس، بس هو عامه يعني السيمتومز مش بتظهر الا مع الليفر فقط ميتاستاسيس يعني،
Okay.
لان
لا
السيروتونين
لا
رابيدلي بروك داون.
السيمتوم دكتور عايشة، السيمتوم بتحصل مع كله، يعني إذا كانت في الليفر، إذا كانت
لا
في
انا
اللنج،
قصدي اللي
حتى في اللنج.
السندروم نفسه، اسمها اللي هي الكارسينويد فلاشينج
أيوة أنا
اوتبوت.
فهمت كلامك. الفلاشينج والويزي تشيست والديارية والحاجات دي بتحصل إذا كان الميتس لللنج، بتحصل الحاجات دي، وإذا كان الميتس
لا
للجي
ميتس
أي تراك
للليفر،
بتحصل.
ميتس للليفر اونلي، لان هو الليفر اللي بيعمل
أنا
ميتابوليزم
هرسلها لكم في
للسيروتونين.
الجروب عشان ما احنا، لقيتها يعني كارسينويد تيومر at all even إذا في الشيست ولا في الانتستين ولا في الليفر، بتدينا كلها نفس السيمتومز، يعني according للمكان اللي فيه، وبتضيف عليها حاجات السيمتوم ريليتد للأورجن المعين.
Yeah,
فهمتيني؟
okay.
مثلا في الشيست معاه ويزي تشيست، هجيب ارسلها لكم في الجروب.
Yes, please share it. Yeah, not to be confused. Yes.
اوكي تمام.
Okay, thank you. Thank you also, Dr. Aisha, for sharing the information. We will update after having discussing the new case.
I think, doctor, that the cardiac symptoms, I think what I read before, the cardiac symptoms is the one that only will appear after liver metastasis. Otherwise,
Yes.
I think only the cardiac symptoms. Otherwise, it will appear without liver metastasis.
Okay. Okay, ready to start?
Okay.
Hello there. I'm Dr. Mukhtar, the doctor in the clinic. You must be Mrs. Lisa.
Yes, I am the one, doctor.
You are 30 years old.
Yes.
We are here to discuss your health issue, and I will examine you. That okay?
Yes, okay, doctor.
Okay. Tell me more about your complaint, starting by the back pain. When exactly started?
So, yes, doctor, I have this back pain really around 6 months ago.
Okay. And is it progressive?
Yes, doctor, it's getting worse.
Okay. And you feel the pain worse with the movement or with the wrist?
Actually, doctor, it's it's better with the rest. It's really bad when I am moving.
Better with the wrist.
Yes.
Okay. If I give you a scale from 0, no pain, and 10 is the maximum, how much you can scale your pain?
I think 6, doctor.
6. Are you in pain now?
Yes, now I'm in pain, doctor.
Do you need some painkiller?
Yes, please, doctor. It would be helpful.
Okay, here you are.
Thank you. Thank you so much.
Okay. Exactly the side of the pain. Is it up or at the middle of your back or at the lower of your back?
It's in the lower back, doctor.
Okay. Does it move or travel anywhere, up or down?
I'm not sure, doctor, but yeah, I was having this like pain in my legs also.
Legs. Okay. Is it pins and needles?
It's like, it's coming from up. Yeah, it's from up the upper part of my leg to lower parts. It's like electricity, doctor. Yes.
Both legs or one leg?
One leg, doctor. My right leg.
Right side. Okay. Is it like electric like pain?
Yes, doctor. Electric leg pains.
Okay.
In the back, more in the back side.
Yeah. Okay. I'm sorry for this question. Did you lose the control over your water walk or back passage?
No, doctor. No.
You have any weakness in your legs apart from the feeling of pins and needles?
And no, doctor. Just with the pain, I really feel like my movement is limited.
Okay. Apart from this, the painkiller helps. Does the painkiller helps in the pain? of your back pain?
Sometimes, doctor. Yeah, sometimes no. It does not help.
Okay. Any trauma to your back
No,
recently?
no, doctor.
Okay. Yes. Is it the first time ever, or you have previous attack?
No, this is my first time, doctor. Yes.
First time. You have any other joint pain or muscle pain?
No,
You have any stiffness in in your hand or other joints?
no.
Okay, good. Back to your complaint, I noticed that you have awareness of your heartbeat. Can you tell me more about?
Yes, doctor. I have this really. I feel like my heart is racing.
For the same period of time?
It has been going on, I think, for 9 months. That I feel that this really racing heart.
Okay, is it regular one?
I think regular, yes, doctor, regular.
Fast one?
Yeah, I feel it like fast, yes, doctor.
Okay, is it regular like tick, 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 or tick, tick, tick like this?
Yes, it's like regular, doctor. The first one you said, yes.
Okay. You have any chest pain?
No,
Okay. You told me also, or I read that you have some short of breath. Can you tell me more about?
yes, doctor. Really, when I'm even doing like moving like around my building, I feel like I cannot take proper breath. Like I'm really short. I have shortness of breath.
So you moved recently from your house?
No, no. When I am moving even outside of my building, even
Okay.
going to
So
work,
with
I
the
feel
exercise, you feel short of breath.
yes, yes, doctor.
What about the daily activity at home? You can do, tolerate it?
At home, yeah, I can manage, but if more than that, if I go outside of my building to go to the supermarket or even to work, I have this difficulty in breathing.
You have any noisy breathing?
No,
You have any leg swelling?
no,
You have any cough?
no,
Any cough up or out of blood?
no.
How many pillows you are sleeping on?
One pillow.
One pillow. Are you waking at night, gasping or catching the air?
No.
Okay. Apart from this, how is your weight?
Sorry.
Your weight is okay, stable, or you lost weight?
I think I lost some weight, doctor. Yes.
And how's your appetite?
It's okay.
Any lumps or bumps in your body?
No,
Any high body temperature?
no,
Okay. Any night sweats?
no.
Any feeling dizzy?
Sometimes, doctor. Yes.
Anyone told you that you are paler than before?
Yes, doctor. My friends at work.
Okay. Apart from this, how is your diet? You are taking a balanced diet?
Yes, I am, doctor.
Are you restrict to certain type of food?
No.
Any headache?
You know, after getting more exercise or more really workload, yeah, I can get some headache, doctor. Yes.
Any vision problem?
No,
Any hearing or balance problem?
no,
Any difficulty swallowing?
no,
Any tummy pain?
no,
Are you intolerant to some weather?
no.
Any change of your water work?
No, doctor.
Any skin rash?
What do you mean, doctor?
Any pigmentation or
Yeah,
darkness?
yes, I have this, like, what you call it, like areas with light skin, doctor.
Okay. And is it all over your body or only a particular area like the hands or legs? You have
It's
photo? You have picture?
yes,
Okay,
yes, doctor.
you can describe for me, is it oozing?
No.
Okay, the sensation over it?
I think it's okay, doctor.
Okay. So you have any change of your bowel habit?
Yes, doctor. I have been getting these loose motions actually.
Is it related to a certain type of food?
What do you mean, doctor?
Pasta or pizza?
Yeah, once you mention it, doctor, I think, yeah, after eating some pasta, I have this diarrhea. I have this motion.
And is it flushable?
Yeah, it's flushable, doctor.
Flushable one. Okay, and does it contain slime?
No.
Any blood on it?
No.
Is it offensive in smell?
No.
Okay. Apart from this, you have any other problem in the period? Sorry for this question.
For my period?
Yes.
Yes, doctor. Actually, for the past 4 months, I did not have my period.
Okay, and before it was okay, regular?
Yeah, before it was okay, doctor.
You have any kids?
No.
Any miscarriage?
No.
Are you using birth control pills?
No, doctor, I don't have partner.
Okay. Any family history of same problem?
I think my sister, she has something called rheumatoid arthritis.
Okay, apart from this, any other disease in the bowel, like cancer?
No, doctor.
In the glands? Any family history of gland disease?
Yes, my mother had problem in her gland, the thyroid gland before.
Okay. Do you feel thirsty, Mrs. Lisa?
No, yeah. Just whenever this loose motion really is not controllable, yeah, I can feel that I want to drink more water.
Are you compensating well with the water?
I think so, but I keep, as I told you, losing weight.
Okay. Any travel history recently?
No.
Are you diagnosed with any medical condition?
I think this skin disease, the skin doctor told me it is something called vitiligo.
Okay. And are you taking any medication?
Only creams, doctor.
You are allergic to any medication?
No.
Any previous infection with the disease called tuberculosis?
No.
Do you smoke?
No, doctor.
Do you drink alcohol?
Only in the weekends.
What's your job?
I'm doctor. I am a secretary.
Okay, I will start examination now. Blood pressure, sitting, standing, and pulse rate.
Yeah, blood pressure sitting is 120/70, standing is 90/60.
Okay, so basal hypertension. Any darkening in the creases in the hand?
No.
Vitiligo. Can I examine the vitiligo? It's vitiligo. It's no oozing. All over the limbs, all limbs?
It's over the hands and over the chest. There is some spots on the chest and also on the legs.
Are you exposed well to the sun, Mrs. Lisa?
Yes, I am, doctor.
Okay. I will examine the eye for jaundice or pallor.
Positive pallor.
Positive pallor. And there is also leukonychia in the hand, right?
Sorry?
Leukonychia in the hand.
Yes, there is.
Okay, I will examine the heart for any murmur, functional murmur.
Negative.
Sorry, I didn't examine the mouth. Any soreness in the mouth? Any sores?
There is only like some glossitis. Glossitis only. Makes sense.
Glossitis, yes, and no pigmentation.
No.
Okay, now I will examine for the murmur. As I said, no murmur.
No.
Okay, and the
only
abdomen.
Only hyperdynamic apex. Only hyperdynamic.
Okay. You told me any surgery before?
No.
You allergic to any medication?
No.
Okay, I will examine the abdomen. Any scar in the abdomen?
No.
The thyroid, a quick exam for the thyroid.
Normal.
Normal. Okay, what's your concern, Mrs. Lisa?
Doctor, this really the back pain, that the one that I have, and this like the pain in my legs. What's the problem with this one, doctor? Why I have this pain?
I appreciate your concern, Miss Lisa. Mostly you have a condition called autoimmune association diseases. Don't bother about the name. It's something attacking your defense system. Sorry, the defense system in your body attacking some organs in your body. One of them, the bowel, the form of loose motion, and the other, the joints. Also, it might lead to vitamin deficiency, and that can explain the back pain for which you have. You have any other concern?
Yes, doctor. Is it treatable, doctor?
I appreciate your concern. Yeah, it can be replaced with certain vitamins, and if we control the main disease, you might be having a near normal life. You have other concern?
It can be cancer, doctor?
Cancer is not of the possibility. However, we will have to run investigation to confirm the diagnosis and rule out other serious condition.
Okay. Thank you.
Time's up. Okay. Let's start the examiner question.
Yeah. What's your diagnosis?
Yeah, Mrs. Lisa, 30 years old, came with complaint of back pain, palpitation, and short of breath. I believe this patient have signs of anemia, positive postural hypotension, dehydration, and also pallor in the hand, in the face, in the eye, sorry. Apart from this, she has celiac features in the form of diarrhea to a certain type of food. However, it's not flushable diarrhea, but still I can consider as celiac. Apart from this, she has vitiligo, one of the association of autoimmune, and glossitis, and glossitis is going with pernicious anemia. So all this finding correlate with autoimmune association. And the back pain she has might be vitamin deficiency, B12, or vitamin D deficiency, as osteomalacia, and the nerve or peripheral neuropathy due to vitamin B12 deficiency. All this was a finding in the history and examination.
Okay, what's your differential diagnosis?
Yes, my differential osteomalacia for the back pain, osteomalacia. Okay, let's say I can't give differential for one because 3 complaints. So for the back pain, I can't give osteomalacia as a cause due to vitamin D deficiency. For the palpitation and short of breath, I put anemia in the top, and both will be associated with autoimmune condition, pernicious anemia, and celiac disease and vitiligo. No signs of diabetes in this patient, and no signs of thyroid. So I can say this is not autoimmune polyglandular type 2. But still, she has association of autoimmune conditions.
So, how can we investigate this patient?
Yes, started by routine blood test with basic investigation, CBC for the anemia and the type of anemia, MCV to detect what the kind of anemia we have, leukocytosis to rule out any infection, inflammatory markers. I will send also for ferritin, vitamins, screening all vitamins B12, B6, and B1, folic acid, electrolyte, full electrolyte, kidney function, and liver function tests, coagulation profile. Hematinemic screening, I mentioned already, if iron and ferritin, transferrin. This is for the blood tests. I can do also ECG and echo for the complication of anemia, heart failure, to rule out heart failure. For the peripheral neuropathy, I can do a nerve conduction study, EMG. However, it might be related to the vitamin B12 deficiency. For the pernicious anemia, yes, anti-intrinsic factor antibodies, I will send for. Celiac screening, specific screening for celiac, including antibodies, anti-transglutaminase antibodies, and endoscopy to take a biopsy and to confirm the diagnosis for celiac. Apart from this, for the complication, I can do X-ray for the back. And if not diagnostic, you could think about MRI. Yeah,
okay.
other autoimmune screening, I will send for thyroid function tests, antibodies, and for genetic testing if I suspect genetic disease.
Okay. How can you treat these patients?
Yeah, I miss also patient has amenorrhea for 3 months. This is also going with celiac. Okay, how to treat this patient? Starting by multidisciplinary team approach, including
Is it
gastro.
or other causes can be?
For what? Amenorrhea?
Yes.
Can be
I was
central.
trying.
Yeah.
Can be?
Panhypopituitarism.
No. It can.
In this patient, celiac. I will think about celiac as a first cause of amenorrhea.
Okay. It can be premature ovarian failure also.
Okay.
But
Yes.
as you said, it's not polyglandular, or it's not polyglandular because only the ovarian is affected. So we cannot say polyglandular. But it can be premature ovarian failure.
Okay. So the management, multidisciplinary team approach, including the gastroenterologist, hematologist, rheumatologist, GP, and specialized nurse, such physiotherapist, and orthopedic gynecologist. Okay. Apart from this, non-pharmacological therapy, counseling, education about the condition and the complication and the association of the disease. And the pharmacological therapy, treatment of the cause. If we have anemia, we have to correct the anemia by blood transfusion. If we have some vitamin deficiency, we have to correct the vitamin by replacement supplements. For the back pain, and yeah, if we corrected the underlying cause, I think patient will have also corrected the back pain and the peripheral neuropathy. Or radiculopathy, could be radiculopathy.
Yeah, it's radiculopathy more because she's prescribing. She's also prescribing bilateral symmetrical. Yes, she's prescribing only one leg. The radiculopathy sciatica.
Beta, yes, we could think about analgesic also, and pregabalin, and some for the neuropathic pain. I think this is the case and the management for here.
Okay.
Amenorrhea, yes, could be thinking about hormonal replacement or treat the underlying cause if premature ovarian syndrome.
Okay. Okay, thank you, doctor. So yes, this is a case of actually the clue in this patient is the skin lesions. It's the one that will lead to all to solve all her symptoms. So the back pain, yes, it's mechanical back pain. So she has specified a specific site for the pain. It's the lower back pain with compression symptoms. And you have covered all the compression symptoms. You have to cover with mechanical pain. You have to cover all the compression symptoms. So this includes, like you said, the change in sensation, change in motor functions, and also the urine and bowel control.
Yes. Add to this the sensation in the perianal.
Yes.
Perianal sensation. Yeah, this is also important. Okay.
Yes.
Go ahead. Sorry, I interrupted you.
It's okay. So regarding the palpitation and the shortness of breath, yes, it's related to anemia. Can be from the celiac itself, or can be associated with anemia, especially that she has glossitis. And for the celiac itself, this is the main issue for her. So for celiac, you have to cover all electrolyte imbalance, like the one she has here, the back pain and the anemia. Also, you have to ask about other other autoimmune diseases, like celiac, Addison, thyroid, myasthenia gravis, premature ovarian failure, premature biliary cirrhosis, diabetes. So yeah, you have covered this all. Okay, yes, that's good. So this patient, most probably, yeah, this is the question that I was going to ask you. This is osteoporosis or osteomalacia?
Yeah, both are possible. Yes, you're right.
All right. I'm not sure. I read that osteoporosis, osteomalacia is pain all over the, not specific types of pain.
Also, she will also not present with compression sign.
Yes, that's right. So this is
Osteoporosis will be, yes, you're right. Yes.
So yeah, osteoporosis. She has osteoporosis with most probably osteoporosis will not cause pain also, except if there is fracture. Fracture.
Yeah,
So
and
most probably
suppose should be trauma also to have fracture.
It can be spontaneous actually with the stress only. I'm not sure. This is what I know, that it can be spontaneous if severe osteoporosis, and it can be spontaneous. Maybe we will need confirmation from our colleagues also.
Okay.
So yes, you have examined everything, but I'm not sure you examined the back or not. I think you did not examine the back.
Yeah, I just reached to the abdomen, then the time was, yes.
So I think the most important thing here is to examine the back, and also
and
to
the
examine
legs, yes, the right leg. Yes,
the neurological, neurological like screening of the motor sensory affection of the lower limbs, especially the right leg.
Yes.
So regarding the investigation, yes, everything you said here, I think because of the back pain, we have to mention also
calcium and the thyroid profile. Yes.
Yes, the bone profile, calcium, phosphorus, PTH, vitamin D.
Yes, exactly.
Alkaline phosphatase. Alkaline phosphatase here can be increased because if it is fissure fracture, it can
fracture. Yes. Yes.
And also you have to do MRI and DEXA scan. It's very important because she has compression symptoms. Maybe she will need like urgent intervention.
Yeah,
so,
at least I mentioned MRI and X-ray.
Yes. So MRI can be, we can say MRI
because suspect osteomalacia, not osteoporosis. If suspect osteoporosis, can put
it will appear in the X-ray. Yes, X-ray.
Yes.
But because we're now era of advanced imaging, I think better to say MRI, because also
MRI to check or detect any nerve compression, doctor. So it's accepted. Yes.
Yes. So I think MRI, because if she needs an intervention by
neurosurgical intervention. Yes.
Yeah.
And it will be emergency. Yes.
Yeah, we have to mention that to her. We have to tell her that we will do urgent imaging to the back, so that if you have any compression over your nerves, we have to refer you urgently to the nerve doctor. Regarding, sorry, I will be back to the examination because I forgot something. Regarding the back pain, I mentioned it. Regarding the anemia, you have done it, yes. Regarding the vitiligo, some people will try to check the sensation over the just by crossing.
Yes.
So the treatment, the most important part to tell her is that you
anemia.
No, to have
the celiac itself.
That, yes, you have to mention her to stop pasta, to stop pizza, all the
processed. Yes.
Then, of course, the vitamin replacement, the electrolyte replacement if needed. Yes, the calcium replacement.
Yes.
I think that's it.
But you confused me when you told me it's not flushable and it's not offensive.
The celiac does not have to have steatorrhea. Some of the people will not have steatorrhea, only the loose motion.
But still, yes, I insist this is celiac because it's related to food.
Yes.
So I didn't put it in my mind that it's not celiac. Yes, it's still celiac.
Yes. It's not necessary to have steatorrhea with celiac. It can be only loose motion.
بيسفوسفونات دكتورة سارة؟
Sorry?
بيسفوسفونات بما إنه عندها ريسك بتاع فراكشر وهي بريماتشور ovarian هتحتاج بروفايلاكس هنا.
Yes, that's right. Biphosphonate. Because fissure fracture, she has to have biphosphonate. Yes. Also, yes, the most important, I think one of the things that we missed is the premature ovarian failure. This one we have to.
Celiac can explain, Dr. Sarah. Celiac can explain amenorrhea.
The vitamin deficiency can explain, but you cannot exclude premature ovarian failure. So you have to do estrogen, progesterone, and
it will be low. Yes, you're right.
You have to do and you do ultrasound also over the ovaries.
Yes, I agree.
And if she asks you about it, you can tell her both. I think you can tell her it can be related to your gut problem or it's related to the autoimmune problem. Both can be. So we have to run more tests. But you cannot exclude premature, especially that she has autoimmune disease.
Yes.
That's it, I think. I will wait for your comment, Doctor. Thank you.
Yeah, thank you, Doctor. It's a big, complicated case. Thank you. Yes, it's good to train about. Yes, Wallah, you're right. We have to train about 3 complain and 2 complain, how to investigate the association. Especially they are bringing like main 1, 3 disease or 3 glands and different manifestation. Autoimmune polyglandular type 2, also the same. But this one, I think, more complicated than men, because men will be clear. You brought all the autoimmune association, vitiligo, celiac, amenorrhea, gynecological, and vitamin deficiency signs, anemia, pernicious anemia, and so it's.
I'm sorry.
No,
but
it's
actually,
okay. No.
I think it has appeared before in one of the exams.
By the way, it's preferred to practice on such scenarios. I'm thanking you. Thank you so much for this scenario. Just to know how to manage the time and how to analyze each complaint and how to correlate all and put a link with these all symptoms. In the exam, you will be more stressed and you might be also more randomly thinking, and you might not reach to the association or the link between all these diseases. So it's a nice scenario. Unfortunately, Dr. Hadil wrote, unfortunately, is common scenario on basis. Thank you, Dr. Hadil. That's why Dr. Sarah brought polyendocrinopathy syndrome. No, it's not polyendocrinopathy. It was association autoimmune. Premature ovarian, yes. Premature, yes. Difficult scenario, yes. Actually, yes. Okay, you didn't overhelp when asked job. Thank you, Dr. Aisha. I need positive feedback. the very complicated scenario. I didn't have time to say here, even I'm sorry for your symptoms. Okay, yeah, you're right. I have to. But what she said I am a cashier. I think I can't remember what she said. I was in hurry to do examination.
I'm secretary, but yes.
Secretary, yeah, secretary is very easy job. She can tolerate. Okay, whatever. Yes, I have to ask. Yes, you're right, Dr. Aish. Dr. Naita, thank you. Well done. Thanks for all. Good preparation, Dr. Sarah, Dr. Bassem, especially in discussion. Well done. Thank you, Dr. Naida, again and again and again. You did very good, Dr. Bass. Thank you, Dr. Ash. Finally, the best you that you were calm. Yes. Even you will be confused. You have to take a breath and to prepare yourself.
Yes, Dr. Bassem, this is a very good point for you.
Yes, I'm always advising for that.
It may be you should be nervous if you will ask any system and you will find the positive in every system.
Yes. Yeah.
But the good point, I think, if this scenario in exam, you will pass it good.
Yeah. Yes. Difficult scenario. So the marks will be also, the threshold will be high. They will give us good mark whenever the discussion is going, because you discover a lot of things. So the threshold will be low. So the whatever you will answer, they will give you good mark. I hope so, because you found some relation, yes, and you find the link between all this disease. But what I can mention is, as I said, it is autoimmune association. Nothing to mention as a disease. So autoimmune. So the defense system attack different parts in your body, gut and even the ovaries, the stomach for absorption, the skin, like this, right? But no specific disease I can say.
The question, doctor, that is it okay to ask to see the patient in the beginning? Just
yes, I hear they allow. Yes. They allow to do anything in the 15 minutes. Sorry, in the 15 minutes. Even you can look at the patient, then go back to the surrogate. Skin rash, you can look at the rash before starting, or even while talking to the surrogate. You can examine the patient while talking to the surrogate. So all are accepted. Whatever you want to do, it's up to you. Manage your time and try to finish all this, the history plus examination plus concern. And don't forget the concern. Whatever the time passed, you reach the 2 minutes remains, forget everything. Ask the concern, answer the concern. If you finish the concerns, ask whatever you want to cover if you miss something important. For example, you miss the social. You can go back to the social and ask him. You can ask for the smoking, for the alcohol, but the concern, they will give you marks on the concern itself. Don't miss the concern. Of course, the advice for me and for all, not only.
Concern before examination or after, Dr. Bassem? Can do before or after?
2 minutes. How you will answer concern without examination? For example, this patient, if you didn't ask how you can answer here, you didn't see the vitiligo. Yeah, I know some of our colleagues do that in the Irish.
Examiner.
Not examiner, the Irish style. They allow you to get the, and the mentor, yes, as you said. But if you know the concern, keep it and reserve it till the end. You can ask what's your concern, then tell him I will address your concern at the end of our examination. But
okay.
Yes, you can do that, but don't forget it. Okay, and from the concern, you might know what you are doing or what you are going to do in the examination. If he told you, do I have a cancer? So you'll focus on the lymph node. So you can do it, but it might be with you or it might confuse you and it will be against you. And it might disturb your thinking when he says something and you didn't reach the diagnosis and still you didn't have explanation to his concern. You might be confused. What he said, he asked me, is it a cancer? Oh my God, I don't know. Is it cancer? So better to collect all the data, the examination, then go to him and address his concern when he said, or the examiner say, 2 minutes left. This is the advice for the concern, but don't miss the concern. It has marks. Whatever you did in the examination, whatever you had from the history, leave all this and address the concern. Okay, before answering the examiner or when he asks you present your case, you have a paper, try to take a breath. He will not ask you to hurry up in the answer. So just think, collect the thoughts, and try to answer him in a calm way. Because if you said something not logic, you say something from here and from there, he might say that you are disorganized, you didn't reach the diagnosis. So try to collect your thoughts, and the paper you can write anything positive in a circle to give you a clue. And by the way, this is what I wrote in my paper. I wrote everything positive. And I wrote osteoporosis, by the way. Imagine I wrote osteoporosis in the differential, but I didn't mention, yeah, sometimes after the disturbance of the case and the difficulty of the case, you forget to mention what you wrote. So try to write everything and look at your paper when you present your case. The positive data in a circles or in circles or in bold letter or whatever you have underlying whatever you do, and try to collect it together and explain to the examiner what the relation between all these. I think nowadays they are straightforward in the case. Rheumatoid arthritis, but also rheumatoid arthritis is a huge topic. It's not only rheumatoid arthritis, it will be seropositive, and you will think about all mixed connective tissue disease and so on. Whatever, some other patient will be straightforward. I hope we'll face such scenarios. The straightforward, not tricky one and syndromic one. Any question, any comment? Fatty session. Thank you, Dr. Sarah, for the case. It's a good exercise.
Thank you. Thank you so much.
Yes. Any other comment from others? A lot of positive comments. Thank you all. I cannot finish the like. Thank you. No more questions? Premature opinion, yes. Okay, see you tomorrow, inshallah, with the communication day. Thank you all. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.